Hello everyone, my name is Khalid Al-Mijari and I'm gonna talk about the effects of the COVID-19 pandemic on mental health. I chose this topic as my seventh current event because it is important for everyone to know and understand that mental health is just as important as physical health, especially in times of disasters. During the COVID 19 pandemic, many people have experienced mental health issues. First, let us define mental health. Mental health includes a person's emotional, psychological, and social well being. It's a state of well being in which an individual can handle stress, relate to others, contribute to the community, and make choices. The World Health Organization recommends the idea of there is no health without mental health, making mental health an important part of health. Multiple factors affect a person's mental health. We will focus on biological and social factors. First is biological factors such as genes or brain chemistry. For example, a study has shown that there is enough evidence to suggest the fluctuation of reproductive hormones can likely contribute to postpartum depression. Biological explanations of mental health issues are becoming more and more popular today and impacting the way providers and treating patients, as well as slowing removing the stigma on mental disorders. Next is the social factors such as life experiences and social economic pressures. Rapid social changes are associated with poor mental health, and the recent public health guides of lockdowns and isolation is a clear example of how mental health is affected by rapid and unusual changes in the society. Although there is no single right way to there is no single right way uh, to react to changes and challenges. The way we respond to it is shaped by our upbringing and environment, among others. The COVID 19 pandemic and the negative social economic effects that came along with it has impacted the mental health of a large population. Reported issues on mental health and well being ranged from difficulty to sleeping or eating, anxiety, and depression. We will discuss available data on how the pandemic and its consequences has impacted mental health, as well as how existing social inequalities magnified the negative effects of the pandemic. The graph shows the obvious differences on the percentage of adults reporting symptoms of anxiety and or depressive or disorder. The data gathered from January to June 2019 reported 11%, and the number increased to almost four times with 41.1% in January 2021. The percentage showed for January 2021 has been the stable number since data collection started in April 2020. The increase is linked to lack of social interaction, isolation, worry and stress over the pandemic, and financial struggle due to job loss. The graph shows four different age groups, and we can see that as people get older, they are less likely to have symptoms of anxiety and or depressive disorder due to the pandemic. Although everyone was affected by the pandemic, the rapid social changes have highly impacted the young adult population. These are adults aged 18 to 24. The data shows that the young adult population have the highest number of reported symptoms of anxiety and or depressive disorder. This is mainly because of social changes such as remote learning, working from home, lack of social interaction, and loss of financial sources. Now I'm going to talk about the role of the financial status on mental health during the pandemic. Financial insecurity caused by the pandemic have negative mental health impacts, especially on lower income households. The graph shows the households that earn 19,000 and above has the least number at 17% of reported major negative mental health impacts from worry or stress over the coronavirus. On the other hand, households that are earn less than 40,000 has the highest reported number at 35% of reported major negative mental health impacts from worry or stress over the coronavirus. So I'm going to talk about gender and parental responsibility. The data is showing that women are more likely to experience symptoms of anxiety and or depressive disorder over men. 49.3% of women and 40.3% of men in a household with children under the age of 18 reported symptoms of anxiety and or depressive disorder. One reason is because of school and child care centers closure. There was an unexpected disruption of daily routines, and the switch to virtual or home-based learning was an additional burden to parents. Another worrying data is the fact that communities of color are more prone to the pandemic and experiencing high rates of COVID-19 cases and related deaths. Going through traumatic situations brought by the pandemic, in addition to existing social and financial inequality in this population group, has resulted in very high number of reported symptoms of anxiety and or depressive disorder. The reported number from Hispanic or Latino, non-Hispanic, Black, and other non-Hispanic, 46.3%, 48.0%, and 48.9% respectively is higher relative to the reported 40.9% from non-Hispanic white adults or 33.1% of from non-Hispanic Asian. Lastly, the effects of the pandemic on essential workers such as healthcare workers and grocery store workers, among other, are more likely to report symptoms of anxiety or depressive disorder, turning to or increasing substance use to cope, or seriously considered suicide in the past 30 days compared to non-essential workers. For example, 22% of essential workers have seriously considered suicide in the past 30 days compared to 8% of non-essential workers. This, this alarming difference is because of the emotional and physical stress that essential workers must deal with every day. This is especially true with physicians, nurses, and other allied health workers who are caring for patients with the virus daily and seeing deaths related to the COVID-19 every single day. Now, I would like to give a short summary of the effects of COVID-19 pandemic on people's mental health. The COVID-19 pandemic has shown serious impacts on many people's mental health. An increase in the number of people in the United States reported that their mental health was negatively affected because of the COVID-19 pandemic. These people also reported symptoms of mental health, such as having difficulty sleeping, lost their appetite, and having increased alcohol consumptions or substance use. The number of people who develop mental health disorders during the pandemic may continue to increase because of some reasons such as lack of social interactions, financial problems, due unemployment, and burnout of healthcare workers. So many people are at risk of developing mental health issues during the COVID-19 pandemic. So first is elderly people have the higher risk of getting infected with COVID-19, and that will limit their interactions with their caregivers, such as their family and friends. So an example of that, like the nursing homes, like many elderly people are staying in nursing homes, and that might limit their interactions with their family and friends. So that this limited the this limited like the interaction with the other people may result and increase the feeling of loneliness or isolation, and can cause depression. However, elderly people are like, according to the data, elderly people were less likely to have negative mental health impacts compared to other age groups, like for example, like younger adults. So the second point that I want to talk about it is that millions of people across the country lost their job because of the pandemic, and people who became unemployed or lost financial sources may develop stress and anxiety. One of the studies showed a clear evidence of a correlation between job loss and mental health disorders such as depression, distress, and low self esteem. During the COVID-19 pandemic, people with low incomes are more likely to have negative mental health impacts compared to people with high incomes. example of that is like when people have low income, they are gonna think and they're gonna be more stressed and have maybe develop some mental disorders because of they're gonna think like if they got infected with the COVID-19 virus, they may like have to go to the hospitals and pay like bills that like they might stay in the hospitals of course and like maybe like have to pay bills to for the treatment and like the length of staying in the hospitals. The third point that I'm going to talk about is healthcare workers may be subject to mental health disorders during the pandemic. The number of people who tested positive with the COVID-19 has been increased, which overwhelmed many hospitals around the country, especially in hospital with the healthcare staff shortage. According to a study, healthcare providers who are directly involved in diagnosing and treating patients with the COVID-19 are more likely to report symptoms of mental health issues. We already have seen like how the hospital are already overwhelmed, and even like the number of COVID-19 a little bit like recently decreased a little bit, but I believe that like still like the we still have like a shortage of healthcare providers to to be able to handle and to be able to diagnose and treat the number of patients that have COVID-19, they tested with the COVID-19 virus. The fourth point that I would like to discuss is, according to one of the studies, is shows that people who have chronic illnesses such as chronic lung disease, asthma, and serious heart conditions are more likely to develop symptoms of anxiety and depression. This is likely because of worrying about the fact that people with the underlying condition are at high risk of contracting coronavirus. Uh, Usually, like the chronic illnesses, like the elderly people have more likely to have like chronic diseases, but like based on the data that like elderly people are like less likely to worry about the getting infected with the COVID-19, even they are like still like the at high risk of getting infected. This is the conclusion. It's sad that there are still misconceptions and stigma on mental health. The idea that a person suffers from a mental illness because the person is mentally weak is not correct. In fact, people with mental illness are very strong and resilient when help is available. Another important point that is usually overlooked is that mental health is more than just the absence of mental disorders. Mental health has long been defined as the absence of mental disorders such as depression. However, mental health is collected of elements other than the absence of mental disorder. Mental health is a collective result of emotional, psychological, and social well-being. That is why it's important that there is support and channel for the elements of mental health. Healthcare organizations and government health agency recognized the importance of emotional, psychological, and social well-being in mental health, and has increased the availability of mental health services, as well as utilizing telehealth to meet mental health needs during the pandemic. This is the end of my presentation, and these are my references. Thank you for listening, and I hope you guys enjoy the presentation about mental health. And if you have a question or a comment, please leave them in the discussion, and I would be happy to answer all the questions. Thank you again.